Hey guys, here we are doing a neurotoxin treatment on this lovely patient. You can see here the patient is all marked up, and you can see here that I'm injecting right near the dot, not directly into it. And this is so that I don't have any of that ink bleed into her skin and tattoo the patient. You can see here it's all very methodically planned. I have a nice grasp on her frontalis and a taut hold on that skin. And just injecting nice and easy with this Comfort Tox 31 gauge 8mm needle, moving on to the corrugators, really isolating that muscle and ensuring that I am using the appropriate depth of that needle insertion so that we get the best results possible. Here we are treating that DAO and having that patient kind of animate and make that face and injecting away from midline. That is just going to ensure that we are not hitting unintended muscles, which, as you know, there's lots of small muscles that kind of innervate around this area. So we want to be very precise with our injections. Treating masseters on this patient, so you can see here I'm going straight in and giving some of that neurotoxin. You can see here I'm right near those dots. It's not a huge deal. I just try to, not go directly into it for all of my injections, treating superficial and deep masseters. Straight in all the way to the hub, I give it and I get out. You do not need to linger in there long. Just deliver the neurotoxin and keep going. And I'm always double checking to make sure that I like the placement of my neurotoxin and where I'm placing my needle. And then moving on to temporalis. It's difficult to get this area really clean, so we just clean right before we treat. I'm always double checking to make sure I like where I'm placing that product and having that patient clench and relax, cleaning really well. And my fingers will kind of move off of her muscle a little bit. You can see it light up there. Kind of looks like that little bulgy appearance. And I'm treating here anterior, medial, and posterior. And then also moving on to platysma band. So you can see here I have a good grasp on that muscle, really grabbing a hold of it, giving the patient a break when they need one and having them reanimate and really pinching that muscle so that I know I'm in the right place. It is a tricky area sometimes, especially where it gets very narrow down at the base. I cleaned really well, of course, and really just trying to keep a good handle on it. Injecting just about half needle depth. It depends on the thickness of the muscle, giving the product and getting out. This is going to help with those necklace lines and help with those muscles from constantly pulling down. And every time you have the patient animate, more might pop up. Don't worry about that. Just treat what you see and be sure to get AAFE certified today.